to The Honest Midwife. Should you worry if you are told that you are Rhesus negative? Finding out you're pregnant for many women is the first time that they really enter any sort of significant clinical setting. Yes, most of us have been to the doctor with minor ailments, but many of us are lucky enough to have got to this point in our lives without the need to find out information about strange sounding conditions. On the other hand, some women will have been in and out of clinical settings and find themselves surprised to find that they feel more anxious than they would have been expecting when they're on receipt of news about their pregnancy. Either way, this video will hopefully help you to fully understand what it means if you are told that you are Rhesus negative. Rhesus D factor is a factor that is found on red blood cells, and a person's Rhesus factor is genetically determined. As you can see from this table, approximately 15% of the UK population are actually Rhesus negative. In everyday life, this element of your genetic makeup makes absolutely no difference to you. However, in pregnancy, it is important that this feature of your blood makeup is determined, as it can cause problems in future pregnancies. If your blood is Rhesus negative and your baby's is Rhesus negative too, then you won't need to do anything. Although your circulatory system and that of your growing baby are separate, there are occasions when small amounts of blood, of your baby's blood, can enter your system. Should this happen and you have the different blood types, there is the potential that your body could make antibodies which could potentially be harmful in future pregnancies. This happens in approximately 15 out of every 1,000 pregnancies. Basically, the antibodies that your body developed in your previous pregnancy wrongly jump into action and can destroy your growing baby's red blood cells, resulting in a condition called hemolytic disease of the newborn, or HDN. Basically, it's severe anemia. Although this all sounds very scary, treatment for this has a very high success rate. However, the ideal is preventative measures to avoid the condition in the first place. The good thing is that the preventative measures are in the simple form of an injection called anti-D. This dose of anti-D attaches to the surface of any baby's blood cells that may have gotten into your circulatory system, and this reduces the chances that your body will create antibodies that could attack baby. The injection is usually given during the 28th week of pregnancy, and if there is considered to be a risk that there's been any blood crossover between you and your baby. For example, if you had an injury to your tummy or any bleeding, you may be given an additional dose. Following the arrival of your baby, a sample of blood will be taken from the umbilical cord to ascertain the baby's blood group. If your baby is Rhesus positive, you will be offered an additional dose of anti-D just in case any of baby's blood got into your system during the delivery. You'll have your blood tested to ascertain how much anti-D is required. As anti-D doesn't offer lifetime protection, all of the above would be repeated in any further pregnancies. It all sounds very serious, but in all honesty, the top and bottom of being Rhesus negative is that it will be recommended that you have a couple of injections that women with Rhesus positive blood group won't need to have. I hope you found this video helpful. If you have, please subscribe, like, follow, do whatever it is that you need to do to keep getting these videos sent to you. You can also follow us on Instagram at The Honest Midwife, and check out all of our classes, antenatal and postnatal classes for parents and babies at Let's Talk Birth and Baby. All the links are written down below. Take care. Bye-bye.